All right, folks, thanks for joining us. I think we'll get started. It's just nearly 2 past the hour. So hello and welcome, and thank you for joining us for session 3 of the Rural Research Collaborative Learning Network, the RR-CLaN. This is the Research, Education and Training Calendar Seminar. I'm Dr. Alex Stevens, the Director of Research at Northern New South Wales Local Health District, and I belong to one of the member organisations of the RR-CLaN. By way of brief background, the RR-CLaN is a collaborative effort bringing together like-minded individuals from similar organisations to provide research learning, training and education opportunities, and also the possibility of collaborative research. So I want to thank the representatives from member organisations for their ongoing support, enthusiasm and commitment to the RR-CLaN and the delivery of the research, education and training calendar. So today's seminar on demystifying consumer and community involvement in research will be presented by Associate Professor Chris Williams. Chris is a conjoint academic holding the position of Research Development Manager with Mid North Coast Local Health District and also Principal Research Fellow with the University Centre for Rural Health at the University of Sydney. Next slide, please, Chris. To officially get us started, we acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians as living culture, their connection to country and their contribution to the life of this region. We pay our respects to the ancestors and elders of the region and to all Aboriginal people, past, present and future, and any Aboriginal people who may be joining us today. So welcome. Next slide, Chris. Just a tiny bit of housekeeping. So given the large attendance, we've muted your microphones, but please feel free to ask questions throughout the seminar if you have any using the chat function, and we'll endeavour to answer them. If we do get time at the end of the seminar, we will unmute your microphones in an attempt to answer some live questions. Next slide, please, Chris. The session today is being recorded. We're doing this for allowing people to view the session at a later date. If you don't want to appear in the recording, just simply turn off your cameras. Next slide, Chris. So now it's my great pleasure to introduce you to today's presenter, Associate Professor Chris Williams. As I mentioned, Chris has dual roles, being the Research Development Manager for Mid North Coast Local Health District and Principal Research Fellow with the University Centre for Rural Health, the University of Sydney. Over the last decade, Chris has led clinical and implementation research in health service settings involving co-design and co-production methods with end users and consumers. This work has included consultancies and funding from agencies such as the World Health Organization, New South Wales Regional Health Partners, and the National Health and Medical Research Council. Now, without further ado, I'll hand over to you, Chris, to guide us through today's presentation. Thank you very much, Chris.
Thanks so much, Alex. Just checking that you can still hear me. Okay.
Loud and clear. All good. Thanks, Chris.
So thank you so much for the introduction, Alex, and the opportunity to talk today. This is a huge area of interest for myself. Before I get into the presentation, I'd also like to acknowledge the traditional owners of the land that we're all meeting from today. I'm joining you from Bundjalung country in Lismore, I'd like to acknowledge the traditional owners past, present and emerging, and also acknowledge any Aboriginal colleagues that are joining the session today. So yes, I'll be talking about community and consumer involvement, CCI. You'll see that acronym a lot in this presentation. And the idea here is to try and demystify some of the concepts around this. So I'm certainly not an expert in this area, but we've definitely made extensive efforts to include consumers and other end users in our research over the last decade or so. So I'm probably not going to give you anything that you don't already know. I don't think I believe a lot of people joining today come from a clinical background, and I think you probably have the necessary skills to tap into or do community and consumer involvement in research. The reality is that research, in essence, really needs better practices in this space, and I believe clinicians have a really huge opportunity to champion this cause. So today, my mission is really just to try and simplify this sort of puzzle of community and consumer involvement and sort of unlock some of the pieces for you, so then you can go and fit them in place in your area of work. And I'll just another preface, I'm not really talking about my research per se, more so the things that we've learnt along the way doing some of this stuff in our work. So just as an overview, I'm going to talk about the why. So why we think CCI is important. I'll clarify some terms and some concepts, then go into some more sort of pragmatic or practical things around where, what, and how, including some core standards to consider. And then I want to finish off with hopefully some discussion around your potential role in CCI. So for section why, don't know if this is going to work, but I thought, why not start with a question and get you to consider your purpose here, why you think we need to do or involve patients in research. The reality here is there's no single answer to this question. And so the point of asking you in the first instance is to get your brain sort of ticking over a little bit and to consider, why is this an important thing to do for you? And I'd welcome any feedback on the chat, although I can't really, oh yeah, I can see it now. If anyone's got any comments, feel free to add them. The other part of this, or the other thing I'd like to think about in the first instance is, well, what do you want to influence in CCI? Why did you turn up today? And how you think you might go about that. Again, there's no right or wrong answer for this particular question. And as we'll get into a little bit later on, this is sort of a bit of a choose your own adventure type situation. I don't see anything coming through. Ah, here we go. Oh, there's a lot. Thank you so much. That's a great start. Yeah, I mean, it's a great point, Diana. If you want to improve things for patients, then we need to know what they want to improve. And especially if that's had the intended impact. There's some questions or points around it's more ethical to involve patients, certainly. And there's a really good point around relevance to patients. Okay, thank you so much. So I'll just take you through some of my reasons. And I guess the starting point here is that we're talking about research and evaluation, and that's important in health services because patients do better in health or research active health systems, essentially. And in fact, a lot of patients believe that we should be doing research within our service delivery to improve the quality. But the stark reality is that much of what's done in health research does not really produce evidence that's useful to improve care for various reasons. And if you just take my word for that for a second, and actually you don't have to take my word for it, you can check out the Lancet series that I've got there on the slide, sort of indicating that around 80% of research is wasted and perhaps not useful to improve the standard of care for patients. That sort of brings us to a question of, well, what makes research useful? And this is a fantastic study by a group out of the US, where they've sort of mapped some features of studies and some questions to ask around how that makes the research useful. And as you can see, I've just highlighted some boxes there, some of those questions. These things relate to patient interaction, patient perceptions. Is the health problem big enough to fix? Is the research reflective of real life? Is it value for money? Can it be done and feasibly done? All of these things potentially have a patient lens that's important to defining how we might go about answering the questions. But the really important here is that for research to be patient-centered, it needs to have patient involvement. There's some practical reasons as well for why we might involve patients. They bring alternative views to increase the relevance. It sort of came up in the chat. They provide different views on the design and how to improve the quality of research. And they also provide some accountability, awareness, trust to their to other patients that might support the function and the operations of research. So making the research more feasible in essence. And then there's some other normative reasons, which we also heard in the chat. You know, if the public are essentially paying for research to happen, then there's a right for the public to also have a hand in deciding how that's done. And you know, there's this idea of moving away from paternalistic science, where just the researchers have the authority and the say on how science is done. There's also increasingly the need to demonstrate partnering with consumers and patients in research. So the National Clinical Trials Framework does stipulate that partnering with consumers as part of accreditation is necessary, and that's sort of pending at the moment, but increasingly likely to be part of accreditation for hospitals and LHDs. And then there's this idea that including patients in our funding applications is going to lead to high success, and there's some really clear examples of that happening. And in fact, internationally and increasingly in Australia, this is being made a requirement to submit an application to demonstrate why, if you haven't included patients as part of your funding application, why you haven't done so. And if you look to New Zealand as an example, there's a really clear mechanism for including patients in research funding applications. Okay, so moving on to some concepts and terms, and I guess this is probably a bit of a trick really. All I'm doing here is synthesizing the sort of plethora of information that exists on this particular topic. So I'm not reinventing the wheel. I've taken all of this from other sources, which I've included at the end of the presentation for you. So what is CCI? As I guess a word of caution, there's a bit of confusion around some of these terms that might be related to CCI. So on one hand, we have participation, and another hand, engagement of patients. And you often hear this interchangeably with the term involvement. My preference is to specify these terms a little more clearly, where participation is about the patients participating in the research. And there's some directionality here and then engagement is more so around the researchers informing the patients or patient groups about the research or what happens in the research, where involvement is a bit more of an active process where the patients are involved in a way which helps shape decisions around the research, the priorities, and also the translation of the particular research. So there's more of a sort of two-way street happening here. And internationally, you'll hear the terms engagement and involvement used simultaneously. For example, in the UK, engagement means involvement, as I've just described it. But in Australia, we use the term involvement rather than engagement. And some other common terms: consumers, communities, CCI partners, and end users. These can all be used interchangeably as well. By consumers, we often mean the patients or potential patients who use a health service. Communities are are rather groups of people who share a common interest, and that's not always geographical. It could be cultural or social. CCI partners are those consumers or community members who are involved in a research or evaluation process. That might be an advisor or a representative of a community or a consumer group. And end users is used a little bit more generally, where is there any person or group, including patients, communities and clinicians or policymakers that might use the research to make decisions. And these also form another important group to potentially include or involve in our research processes. Okay, so this is a bit of a model that's used internationally, but developed by Tanya Simmons, who developed the ACTA Consumer and Community Involvement Toolkit. So here we've got sort of levels of involvement as a bit of a hierarchy, and just this is really to sort of demonstrate how we can involve, or keep in mind how we can involve consumers, but forms a bit of an accountability lens as well. So at the bottom we have, I should say that no matter where your involvement lies in terms of the level of involvement of consumers, there's quite a bit of flexibility in how that happens, and it can be from some advisory to decision making, or a mix of these. It could be one-off, recurrent, or long term. The principle here is more so around the commitment to take on board that advice or decision making process with the patient. So at the bottom rung, we've got tokenism, which is unfortunately common, where there's feedback sought, more like a box ticking type activity. The CCI partners or clinicians are asked to inform or influence a project, but that doesn't always happen or lead to meaningful change in direction. Then moving up the ladder, more meaningful involvement, where researchers seek CCI partners input on specific issues, and that does actually lead to sort of real change and help sort of shape the decision or actions around the research. Then co-produced or co-designed studies, where there's more of a balance of power and responsibility between researchers and CCI partners, and this often happens across multiple aspects of a project, and involves more of a sort of ongoing partnership. And at the top of the ladder here, we've got consumer-led activities or studies, where the consumers are the people in charge of steering the agenda, and different parts of the research, where the researchers are more so commissioned to help with the operational aspects of the research. Okay, so how to, as I said before, this is a bit of a choose your own adventure type exercise, and my thoughts go back to this. I don't know if anyone remembers these books from the 80s, but the advice here is really that you don't read these things from start to finish, and CCI doesn't just go from start to finish. Is a bit of a, you have to be making decisions along the way, and every now and then those decisions lead to a good outcome or potentially a negative outcome. But the point of the process is to reflect and sort of pivot where necessary. But there's no sort of fixed way of doing these things, no protocol per se. You have to truly build your own adventure in CCI. So this section, I'm trying to get to some of the options for where you might involve patients, how you might do that, and some of the core standards that you might consider for success. But in this process, you're sort of really reflecting on the why, your purpose, the reasons for including patient partners or community partners in your research. And this is where this is really steering the where and the how for you. So where? Virtually anywhere. So if we consider the research cycle here from identifying and prioritizing research, designing the research, undertaking and managing the research, interpreting or analyzing, disseminating and implementing, and even continuing that cycle in iterations of research. There's a role for consumers potentially anywhere in this cycle. In the boxes there's some examples of how, or the activities that patient partners can be involved in doing. Most commonly you see patients and consumers involved in the identifying, prioritizing, and that's a really good starting point for any research process. But where the opportunities really lies in the sort of co-design, contributions to the design and management of research, and in particular the dissemination aspect. So everyone I imagine has heard of lay summaries, and this idea that a lot of the waste in research is that the results of research sort of lie in a buried underneath a paywall at a journal, and really working with consumers and community to disseminate the research better can potentially lead to more important influence and outcomes from the research. Okay, from here I wanted to bring you back to this idea of levels of involvement, and then try and sort of more clearly specify how these levels interact with the activities in which you might undertake in CCI. So I've skipped the tokenism bit because we sort of want to avoid that. But if we look at the meaningful involvement rung, some options here are you'll see around consumer reference or advisory groups, where the patients or consumers are advising on particular aspects of the research in that research cycle, but the intention really is to action that advice where possible. Moving to the co-produced rung, we might be including members consumers or patients as members of our steering committee, or action groups, where there's equal elements or equity in the decision making. Perhaps that's a question of equity in the numbers that represent those groups, as much as their influence on the decisions, and or teaming researchers up with consumers to do particular parts of a study where there's research mentorship or research buddy type systems, and they're really forming part of the team. And then at the top, the CCI partners really dictate what's happening with research, where it's dedicated, how it's done, and engaging the researchers for support, really in a technical role rather than a leadership role. Just a little bit more on how. So this is I found this a really fascinating study which comes out of the US. This group went to extensive lengths to define how best to involve patients in research studies. So this was a series of studies. They started with a systematic review where they basically pulled the results of 200 odd studies and extracted the types of activities that patients were involved in research studies. And then they went through a consensus process with consumers to ask them, well, we've got all these options that seem to be used. Where do you think they fit in the research cycle? This is a pretty noisy graph. I'm sorry, but I'll try and walk you through it. But what we have here is the types of options down the left-hand side, and the research or the stage of the research cycle at the top. And then the colours, the colour purple indicates the level of recommendation from the consumer group as to the appropriateness of the type of involvement. You see there's an engagement terminology, but they mean involvement. The colour purple, so dark purple, is a high level recommendation based on consumer advice that this is an appropriate involvement method for that stage of research. So we've got community partnerships in the sort of planning stage and then the sharing stage, having high level of recommendation from consumers, focus groups, certainly in the prioritising and planning, and then sort of varying levels of recommendation for interviews, meetings, resource development, resource communication via print material, engagement in social media, storytelling, so high level recommendation for framing questions, and then the research member aspect, being quite a high level recommendation for the doing of research and through to the sharing of research. Okay, so this section I've just got to some considerations around the sort of core standards for doing CCI. And first in the planning phase, really here I believe you could be considering what the problem is that you're trying to solve with CCI, and at what stage you think you should involve patients or members of the community. And to answer these questions, as I sort of indicated before, there's no right or wrong answer, but some of the considerations might be: do you have an awareness around how the insights from a patient can help you in your research? And some considerations around the target audience and how you'll find them. Certainly considering ideas around diversity and inclusiveness. So ensuring that you've got the right patient representatives that you're looking to include, and then considering the sorts of methods that you might need to employ to find those people. Another consideration is around is that particular aspect, so the types of people, the representatives that you need to find, actually your decision to make. And so should you be going back to patients and community in another way to identify, well, who are the people we need to speak to and include in this particular process? So I guess it's a bit of an iterative process in the planning stage to sort of uncover these the answers to some of these questions. And another core consideration is, well, how are you going to remunerate these people? As a researcher who gets paid to do research, I have a bit of a problem approaching people to ask for their time pro bono, and so we'll go to whatever lengths necessary to ensure those people are remunerated. And there are some really good resources, again, that I've got at the end, which give you some guidance on how to structure that reimbursement. But certainly a fundamental aspect is preparing a budget or considering a budget for involving community and consumers in your research. Increasingly in Australia, there's a real appetite to include CCI activities in your funding applications. If you haven't had the luxury of accessing resource and funding to do some CCI work prior to the submission of a grant application, for example, then there's certainly there's certainly a rationale to include that in your funding application. Okay, preparing and managing. So, I mean, a critical thing to answer or to consider is the environment in which you want to create for the success of consumer and community involvement. So considering things like, what are the skills that you need to provide your potential patient partners to do the job that you're asking them to do. Not only that, what are the skills that you need to ensure that the CCI is as intended? The culture in which your organisation has may not be conducive to involvement from patients. potential threats or safety concerns with patients would bring them into your organisation? Do you need to consider how to create an environment or where you physically hold the CCI activities offsite from the hospital, for example? And then one factor that's often forgotten is why a patient would want to be involved. If we set aside the remuneration aspect, often inviting consumers or patients into a research process it can be confusing, can lead to frustration, and that's really around clarifying what you need from the patient, but also what their expectations might be to contribute to the research. And on that, how do you manage those expectations? So these expectations are likely to change over time. So including or producing clarifying documentation is often a good idea, considering remuneration, as we talked about, making sure there's regular checkpoints, potentially including a CCI lead or liaison. That's someone who's in charge of making sure that the consumers are the role of consumers are, one, meeting the expectations of the research team, but also ensuring that those people are comfortable, capable, and their expectations are being met. And then obviously considering effective communication. And you know, that doesn't extend to the person-to-person communication. It extends to the documentation, the feedback loops, in any sort of informal or formal communication process that can help make sure that the CCI process is as effective and seamless as possible. And then one last thing that's often ignored is this idea of evaluating the impact of CCI on your research. This, you know, as I indicated previously, is it's messy and it can be chaotic, and that's okay. The real journey here is about learning from some of the failures that we often encounter in some of this sort of chaotic nature of research, and including different people with different perspectives on research in that process. So evaluating the impact is really fundamental, including the experiences of consumers in that evaluation, and then using that to make change for your next journey, so to speak, and then concluding the actions, and it may be at a project level, it may be at the activity level, but certainly making sure that you're providing feedback to those consumers, acknowledging their contributions, but considering how there might be some continuity in some of those roles across a program, a project, or into the future, and making sure that there's a mechanism to make that known to the CCI partners. Okay, I just wanted to finish up with a couple of pointers towards some really effective tools. So a lot of what I've spoken to today comes from some of these tools. This is from the Western Australian Health Translation Network. They have a fantastic resource book which takes you through these 5 stages of CCI, or involving consumers in health research. And then also point to the tools that you might consider or use for each of these phases, and how to plan, manage, evaluate, and conclude involvement. So check out that one. And the other one is the ACTA Consumer Involvement Toolkit, which is orientated around understand, so providing information to understand and clarify what CCI is, how you might do it. Supporting planning, they've got budget templates, protocol templates, and then some in-depth advice around undertaking CCI and evaluating CCI. So I just wanted to finish off with this. And I started with this question around your role in CCI and how you wanted to influence CCI. So I think we've got a bit of time to open this up, and I don't know how this is going to work, to be honest, but we can give it a go. These are some of my ideas around potential roles in CCI, and again, it's a bit of a hierarchy here, and I guess from what I've seen, there's always this willingness, this role of supporters to do or to include, for including consumers and patients in research where we agree it's important, we advocate for it, and we can ask, well, why isn't it happening? Or trying to hold others accountable for some of these actions. A step up from that is enabling the process. So you're a supporter, but you have a bit more of an active role in the operations of CCI. That might be ad hoc, it might be based on an opportunity that you become aware of. But I wonder where the role of leaders for CCI are, and I guess it's certainly an emerging space, but from my point of view, this doesn't have to be, and possibly shouldn't be, researchers leading CCI. And my thoughts and I wonder where a clinician researcher or a clinician who's engaged with research fits into this CCI leadership space. So I guess I wanted to throw that out there. And in my view, a leader of CCI is someone that is a strategic enabler. They have a sense of accountability and ownership to really drive these processes to occur, and they're committed to in some ways a systematic process or journey for CCI to happen in research. So I might, how do you feel about this, Alex? But welcome any comments either via the chat, any questions. In fact, I don't have anything else to talk about today, so we've got 20 minutes or so to flesh some of this stuff out a bit more, answer some questions, have a discussion if you like.
What I have done, Chris, is I've unmuted the attendees' microphones as well, so you can unmute. I suppose potentially if you want to ask a question or make a comment, maybe raise your hand and we can get to you in the order that you've raised your hands, I suppose. But you can unmute yourself if you want to have a comment, make a comment, or ask Chris a question. The chat's been quite active, Chris. There's been an engaged discussion, which I'm afraid I haven't been able to comment on or keep up with because of my lack of expertise in the area.
That's amazing. I'm delighted by that. I wasn't able to see it on my screen, I'm sorry. So
yes. One thing I do want to reflect on, Chris, it'd be interesting to get your thoughts. There was a comment there around how the approach, I guess, to involvement of consumers and community in what we do, say in research, should mimic or mirror what potentially we do operationally. And I know they're two different things. In research is a particular process, and clinical operations or clinical delivery is its own unique aspect. But do you have any thoughts there in terms of, we have an approach to involving consumers in health service planning or health service delivery, and how that may be similar or different, I guess, to the involvement of consumers and community in research?
Yeah, I'm afraid I haven't had too much exposure to the patient or consumer involvement in service design and or delivery, but like you say, I'm certainly aware that that's common. I mean, I'd probably tend to agree that the processes can overlap, or at least the skills base are probably very similar. I imagine that in the service design and or delivery involvement area, there's still this sort of committed, so the philosophy around being committed to taking on board patient opinions and advice, and changing the direction of services where possible, considering the level of involvement and the actions that that align with that level of intention. Yeah, sorry, Alex, I can't really comment more on that, but I mean, I'd suspect that, you know, back to my point around clinicians as CCI leaders, or health service employees as CCI leaders, I suspect that, yeah, the clinicians and health service employees do it a lot better than researchers.
Yeah, sounds good. And I think the principles are probably very similar, but the approaches and practice might be slightly different or tailored, I guess, to whatever you're doing. I see that Angie, sorry, Chris, that Angie has her hand up. Chris, if you want to.
Yeah, thanks for that, Alex. So I'm just currently sitting in a project officer role looking at a model of care redesign for a mental health facility up in the Northern Rivers. One element of that was to look at having consumer engagement. Obviously, I do work with a high-risk population, so contacting ex-service users, it probably would be, too high risk in regards to running focus groups and whatnot. So I've been looking at other options and looking at consumer advisory groups, our peer support workers, things like that. I'm just wondering what your perspective on that is. Like, it might not have as much weight being a consumer representative, but just any guidance around that is much appreciated.
I'd probably go back to this idea of the purpose of engaging or involving a consumer in the work. So what do you intend to get out of involving someone?
From our perspective, basically how our service looks, what does our program look like moving forward, and how do we work with peers on the ward, and a plethora of other things as well. But
yeah, my advice would be to start mapping that out, and then look to, I mean, that the article by Daniel Mullins is a really good, I think, a really good example of how they've been able to map the phase or and the purpose almost to the type of activity. That's I think the strategic sort of planning that I would encourage you to consider.
Okay, thank you.
I have another question or hand up from Ryan. Ryan.
Hi, thanks for that. Look, I think as a consumer engagement coordinator in districts, I guess working with the peer workforce and with consumer reps, I think we often try to find ways to involve both groups in consultation. So you have a peer work perspective and you have a consumer representative perspective, because I think sometimes peer workers who work in services may not be as comfortable talking about points which affects their own livelihood, whereas in consumer reps might have more freedom to be able to actually express certain viewpoints and perspectives accordingly. So I think sometimes in the public sector, we tend to focus a lot more on design, delivery, evaluation. We don't really focus on the research component as much as we could. So having these conversations around, so it's probably more comments rather than questions, but just I guess continue to reiterate the fact that involving consumers within these sort of using the ladder of participation and ways to actually engage will be really effective. And I think having education and research as part of this will definitely be quite significant. There are actually consumer-led research groups on social media and other places where people gather together to talk about consumer-led research and lived experience research. So I think it's good to continue to look for people who want to engage in this space and get some of that guidance. Like if you want to get the expertise, speak to those with the expertise, and they'll be able to provide more guidance around that as well. Some of the points I just wanted to continue to back up, I guess.
Thanks, Ryan. Thanks for that perspective. Are there any other comments or questions? Chris, is there anything else you wanted to add?
I mean, I don't think so. I mean, a couple of takeaways from me would just be that planning is key. Involving people that may not have traditionally been involved in research can be threatening, but it doesn't have to be scary if you enter it with an open and a sort of flexible mind about how it's going to function for you, and expect to get it wrong, but that's okay, and just keep having a go.
Yeah, fantastic. Thank you very much, Chris, for the very informative presentation. And this is the second time I've actually listened to Chris's presentation. And each time I've learned a lot. This is not an area as a researcher. I've been a researcher for 20 years that I know a lot of, and I know that's what I should be doing a lot more of, particularly moving beyond the tokenism and really engaging and involving consumers and community to the degree that they deserve, and the respect that they should be afforded. Chris, I might backtrack one slide, I think, to give a plug to the next session next month, which I think is on how to read and interpret a systematic review. So we've got the date penciled for the 3rd of May, but we'll confirm the time. Just be on the lookout from your local representatives regarding the communications for that one. And please, next slide, sorry, Chris. If you've got a spare 5 minutes now, love if you could give us a little bit of feedback on completing this brief evaluation survey. Probably only take 3 or 4, actually 5 minutes to do. Other than that, I think I'll draw this session to a close. Thank you very much for attending, guys. Have a fantastic Easter, and hopefully we'll see you in about a month for the next session. And thank you again, Chris, for the fantastic and very informative presentation. So thank you, everyone. See you next time.
Thank you.